Synergy Wellness, Chiropractic, and Physical Therapy in New York City. Today we're going to discuss Upper Cross Syndrome. What is Upper Cross Syndrome? It's a postural deviation whereby the shoulders come up, pull forward, and the head is carried forward. Some of the common causes of Upper Cross Syndrome are working in front of a desk, maybe with poor ergonomics, maybe a poor computer setup. Also remember, we're all on smartphones much more than we used to be, with our heads down. Anybody that works a job with their head down or forward, dental hygienists, attorneys, students. So Upper Cross Syndrome is very common. Some of the symptoms you would find with Upper Cross Syndrome would be neck pain, neck stiffness, headaches on and off, stiffness and pain across the shoulders and also in between the shoulder blades from time to time. If you feel like you have Upper Cross Syndrome, watch the rest of this video. In Upper Cross Syndrome, the trapezius are really tight, pulling the shoulders up. So let's show you a great trapezius stretch. You're going to grab on your desk chair, you're going to grab underneath the seat cushion, depressing your shoulder, and you're going to tilt your head in the opposite direction. And you can also use your hand to gently pull and open up that trapezius and stretch it a little bit more. You're obviously going to do that on both sides. Another alternative way of stretching the trapezius is to do it this way, where you take your hand and pull it in the opposite direction and tilt your head in that same direction, again stretching the trapezius muscle. The second muscle we want to stretch is the pectoralis muscle, which pulls the shoulder forward, and then the pec minor underneath pulls the shoulder forward and down. So we want to find a small ledge here, or best to do it in a door frame, and you're just going to step forward and open up the chest area here to stretch the pec major. And to stretch the pec minor, you'll just raise the arm up and the elbow up slightly and do the same exact stretch. The third muscle we want to stretch in Upper Cross Syndrome is the suboccipital tendons behind the head. We're going to clasp our hands behind our head like this, and we're going to gently apply pressure back towards our hands and elongate our spine upward while creating a double chin. The motion looks like this. We don't want to push our head down like this. You can hold this stretch for about 30 to 60 seconds. Now we're going to go over 3 exercises to strengthen the weak muscles that you find in Upper Cross Syndrome. The first group of muscles we're going to strengthen are the intrinsic muscles in the neck. This is a really simple exercise you can do. What you're going to do is you're going to glide your chin back underneath the ear just like this, and this motion here creating a double chin. So the motion looks like this. Now if you want to get more advanced, you could use a TheraBand like this. You don't want to do this motion like this or this motion like this. It's a nice simple gliding motion like this. The second muscle group we want to strengthen with Upper Cross Syndrome are the lower trapezius and the rhomboids. So we're going to do a wall angel. You're going to put your back, your shoulders, and your head against the wall, all while placing your elbows, the outside of your elbows, forearms, and the outside of your hand and wrist against the wall, and do a snow angel, or what we call a wall angel here. And it's a lot harder than it looks. And you can do 4 sets of 10 to 15, all while keeping your arms, forearms, elbows against the wall, touching the wall at all times throughout this whole motion. And the third exercise for Upper Cross Syndrome is more of a postural reset exercise, courtesy of Muscle in Motion.
Pectoralis stretch and thoracic mobility. Anchor one end of the strap at shoulder height, grasp the handles and turn so that your back faces the strap. Raise your arms to the side, forearms vertical to the floor. Slowly take 1 step forward, push the thorax forward and push the head upward. This exercise stretches the thoracic muscles, anterior deltoid and abdominals. It also improves passive and active mobility in the thoracic spine. This stretch is very important for all those with flexed posture, rounded shoulders, and forward head posture. Improving shoulder joint mobility, this exercise also improves mobility of the thoracic spine. When stretching the shoulder, the thoracic spine curve flattens or straightens. In addition to passive stretch, it is recommended to include active stretch as well that includes contraction of the antagonist muscles. The instruction will be to push, protrude the thorax forward, and at the same time push the head up and lower the chin. Protruding the thorax and pulling the head up will activate the thoracic erector spine. Lowering the chin will reduce cervical lordosis and assist in extension of the thoracic vertebrae. To increase active stretch, it is possible to release the handles without leaving the stretch condition. In other words, activate all the necessary muscles to maintain the stretch position. Variation using 2 doorposts.